Good afternoon. My name is Lucy Aquino, and I'm the Chief Executive Officer of Hispanocare, Inc., a program of Advocate Illinois Masonic Medical Center and affiliated with Gottlieb Memorial Hospital. Today you are watching a live interactive show brought to you by CanTV Cable 21. During the next 25 minutes, we'll be discussing babies. And we invite you to call with any questions that you may have. Our lines are now open. The number's at the bottom of your screen, area code 312-738-1060. Our lines are now open. Joining me today is Dr. Rawda, Pediatrics Specialty with Advocate Illinois Masonic Medical Center. Allow me to welcome you to the show.
Thank you, Lucy.
Thank you for joining us today. Now, Dr. Rawda, this is an interesting topic for me because we talk about everything on CanTV and with our Hispanocare community educational programs. But babies is an interesting one. That's not one that we have done in quite a while. So I'm really excited to ask all these wonderful questions, especially for our viewers and new parents, first-time baby, moms who have having baby for first time. There's a lot of unanswered questions.
Sure.
So that being said, and as a specialist in pediatrics, I do want to ask, there are so many things that new parents need to know, especially new moms, since they're the ones who are really watching over the babies, especially in those informative months in the beginning. And you always get that one baby that cries and it doesn't sleep and doesn't sleep. Why not?
You know, Lucy, I've been doing pediatrics for more than 10 years. And when I had my first baby, it was also a learning experience for myself as well too. Mm-hmm. Parents, they come with different expectation, especially with the new moms. Babies tend to cry, and that's what all they know how to do and what to do. If they're hungry, they're gonna cry. If they lack of sleep, they're gonna cry. If they're in pain, they're gonna cry. You know, interesting, moms recognize different cries of a baby, mm-hmm. and that is very helpful. What we need to focus on when a baby cries for something abnormal. You know, when your baby cries for like more than 30 minutes, it's concerning, but sometimes mm-hmm. baby cries for hours, mm-hmm. and they don't go to sleep. There are like normal cries, we call it like colic pain, mm-hmm. Like especially in the first few weeks of life, mm-hmm. usually like the second week or the fourth week of life, especially from the time from 6 to 10 around midnight, we call it like colic pain. Mm-hmm. Usually this colic pain, it tends to decrease over time. So by the age like of 4 months, usually most baby, they overcome this cry and they become more healthier. They might cry for some pathologic or something bothering them, like constipation, or if they're gassy, mm-hmm. they can be fussy as well too.
Right, but it's not normal for a baby to cry for long periods of time. So obviously for new mothers, this is something they definitely have to pay attention to.
That is true. Some babies, if they cry for, like I will say, more than 3 hours without calming down, if your baby is calming down after he or she cries, that is reassuring. Mm-hmm. But if they continue to cry, you have to know how to reach for help. I will say your first help will be calling your pediatrician office, mm-hmm. or reaching to your nearest emergency room.
Mm-hmm. Especially if you've already changed them, you've fed them, you've bathed them, you've done you've hugged them, you've rocked them, you've done everything possibly to calm them. But if they're still crying, that's a sign that something's wrong.
Yeah, that is true. Most babies, like by feeding them, changing them, and also by holding them itself, massaging, all of this can help.
Mm-hmm. So after you've done all those things and hopefully things go well and your baby does go to sleep, what is the best way to put a child to sleep, an infant to sleep?
Actually, the research showed that putting your child back to sleep is the best way ever. Mm-hmm. Because we noticed that babies who are back to sleep, they have lower incidence of mm-hmm. sudden infant death syndrome.
SIDS.
Yeah, it's not as common as it used to be in the back of the days when babies were left to sleep, however, and whatever.
Right.
But now we're seeing this on a better outcome.
So babies should be put on their back.
They always have to be on their back.
Right.
And even some parents, they think that babies might choke if we put them on their back.
Right.
But I can reassure parents, babies have good gag reflex, and if they are on their back, they know how to respond and take a deep breath and be okay.
And this is what makes babies smart, because they are very smart.
They are.
We don't give them enough credit. Dr. Rawda, here's another thing that I hear, and my babies are no longer babies, so they're grown. But I do remember, and I hear a lot of mothers today say this: "Oh, I got a baby who his poop is changing colors, or it's green, or it's this and that, or it's yellow, and it just doesn't make any sense." Is that something to be concerned about?
Oh yeah, the color in general, it's not a major issue. Normally, baby after they're born, right after they're born, they have like a dark color, like a dark black color, and usually it clears up to more like a greenish and then yellowish color. So the color of the baby poops is not a major concern. But if it's different, meaning it's getting more harder or it's getting more loose, there might be some issues, and you have to reach for your healthcare provider.
Again, count on that pediatrician, because any questions that you may have, that's what he's there for. Pick up that phone call and give your pediatrician a call. Now, and it's also okay that babies actually have a bowel movement 8 to 10 times in a day.
That is true. Some babies, especially breastfed babies, they tend to have more frequent bowel movement. There's oftentimes parents call me and they tell me, my child or my baby did not poop for 2 or 3 days. It's also common for babies not to poop every day. Sometimes they have it like once a week, and that's all considered within normal range.
Oh, okay. So parents shouldn't get too worried, but if they are, they should be calling their pediatrician. Doctor, another question that comes up a lot that I hear too are mothers who are asking about the umbilical cord, how they should take care of the umbilical cord. What should mothers be doing, or even fathers, stay-at-home dads, what they should be doing?
This is a very common question too, and they usually after birth they put a clamp for the cord. Usually cord falls off the 2nd or 3rd week of life. Sometimes it delays, usually not beyond the 2 months of age.
Okay.
If it does, this is something concerning, and you have to call your healthcare provider. The most important thing in caring for the cord, making sure that it stays like dry all the time.
Okay.
So don't use no alcohol wipes, and try not to cover it with the diaper.
Which a lot of parents do in different cultures. I mean, I know in the Latino culture, mothers tend to what we call a faja, sort of like a girdle, but it's really a diaper wrap around the baby's cord to hold it in place.
That is true. The other thing you watch for is infection. Although it's rare, but it could happen in the umbilical cord. There's oftentimes parents, they call me, they tell me, the cord is oozing and there's blood around it, what I can do. This is very common, and this is very normal. So we don't have to panic and worry about it much. All what you need to do is just to clean it with a Q-tip and not worry about it. If there's like a foul smelling to the area, or if you see it's getting more red, or if you see like a greenish discharge, this is some evidence of infection.
Right.
And you have to bring it to the attention of your healthcare provider.
Again, very important. Now, doctor, I also know that during that process of the 10 to 21 day from birth, that the child's umbilical cord should fall off between 10 and 21 days is usually the norm. The baby shouldn't be given a bath.
The baby, we don't do full bath
Right.
for baby in the beginning, but
Right.
you could do sponge bath and be careful not to reach to the umbilical cord area.
Very important. Again, avoiding any possible infections.
That's true.
So, doctor, when the baby is under 3 months old and the baby has a fever of 100 plus or higher, and the baby's having trouble breathing or having abnormal bowel movements such as diarrhea or blood or mucus in the stool, is that typical? And how important is it to call your pediatrician?
This is very critical. What we call a newborn period is very critical time for the parents and for the healthcare providers as well too. The definition of newborn for us is up to 28 days, and babies normally don't have fever. If they do have fever, that's something concerning. For us, what's considered fever, it's 100.4 or above. Best to be checked in the rectal area. Ear thermometer might work as well, but if you notice that your baby have fever, especially if there is no other symptoms like no runny nose, no cough, no cold, that can be evidence of a serious infection going on, and you have to either to call 911 or call your pediatrician or bring him or her to the emergency room.
Very important. I want to remind our viewers again that joining me today is Dr. Rawda, Pediatrics over at Illinois Masonic Medical Center. And to remind our viewer that our lines are open. If you have any questions, please give us a call. The number's at the bottom of your screen at area code 312-738-1060. Doctor, when babies are crying, they cry for various reasons. And some of those could be what? And they can be simple reasons too.
That's true. Baby cry, as we discussed earlier, can be just needing to be fed or needing to be changed, or a baby need to be held simply, but colic pain is the most common as well too. So we have to pay attention, especially, like if your baby crying for hours or if the baby cries for a longer time. So you have to be concerned and bring it to the attention of your healthcare provider.
Sometimes wonder too, because when you have newborn babies and they think that they sleep all the time, sometimes babies can't sleep either, and they could be crying just because they're overtired, or they need to be burped because they've got some gas buildup.
That is true. Gas issue is very common in newborn, and not only breastfeeding mom, they get gas issues. The babies get gas issues. Only with formula-fed babies, they might have some gasiness. And the first sign, you look at the baby is crying and irritable, miserable. You look at the baby belly, and if you see the baby belly is distended, so basically you might be dealing with gasiness. Especially with the new and different type of formula that are being introduced, that can bring a lot of gasiness. So, and if that happens, you have to talk to your healthcare provider, and they can switch around different formulas and try the best one that can be suitable for the baby.
Right.
And each baby, they might like special formula, like other baby might like the other formula.
Right.
That's why we have all this sort of formulas out there.
So you can really just kind of test and see, with the advice of your pediatrician, of course. If you're changing formulas at any time, you should be discussing that with your pediatrician.
That's true.
But obviously there are so many choices out there, so if one doesn't agree with the baby, there's always going to be another.
That is true. I want to focus on breastfeeding too, mentioning formula, breastfeeding is so important for babies and for moms. It has so much advantages. The brain of the baby usually it develops over the first 2 years, and the evidence showed that breastfed babies, they have like better outcomes, and they benefit more from having the breast milk on board. also to protect them, especially with younger babies, they are prone to more infection. The first few days, the breast milk is full of materials that protect the baby from getting infection and getting sick. So
So it builds up their immune system.
it really
Right.
does, and that helps all babies. They might have also like the same issue like gasiness and fussiness with the breast milk. The mom should watch like for her diet, see if there is anything in her diet, especially like the dairy product, the cabbage, or anything can cause gas issue,
Right.
or the onion,
Right.
bad taste for the breast milk.
Or spicy food
Yeah,
as well, right? It
Yeah.
does affect the milk.
yeah, it really does, and we have to watch for these. The other things with breastfeeding, it helps to initiate the bonding between the mom and the infant, and it's a good experience. Some of the moms, they get fatigued or tired from constantly breastfeeding.
Right.
They have the option of doing pumping. You
Right.
can pump the milk and put it aside. It stays like
You can freeze it.
yeah, you
right?
can
And
freeze it,
and everything, right?
and it stays around the 3 months in the
Right.
freezer, like almost a week if you put it in the refrigerator, and the dad can have also the opportunity
Right.
to feed the baby with the breast milk as well too.
Right, which really is the best thing that a new parent can do for a newborn.
That is true.
So, Doctor, I do want to remind our viewers that with us today is Dr. Ayman Rawda, MD, and he specializes in pediatrics with Illinois Masonic Medical Center. His office is at 3000 North Hostet, but if you have any questions for the doctor, you want to call him later on at his office. If you can't get to him today because of some questions you may have, you can reach him at area code 773-880-1075. Again, that number is 773-880-1075. Now, Dr. Rawda, I want to talk a little bit about a newborn screening. I mean, a lot of times we hear that term for a newborn and doing newborn screenings. Can you really talk a little bit about that?
That's a good question, Lucy. I thank you for this question. The newborn screening is very important, and all the states, they run this program. It might vary from state to state for what they run, but usually they screen for we do the hearing test. Also, there is some genetic diseases that we screen for in the state of Illinois, like sickle cell or hypothyroidism, and there are other rare diseases that we screen for. And it's important to screen and find out about these problems very soon and early on, because some of those can have a major sequelae on baby's health, like if baby left and without a hearing test, they might end up deaf, and it might affect their speech and their learning.
Sure.
Yeah.
So let me ask you, the newborn screening is done when? While they're still at the hospital before discharge, or is it done later on when they return for the first pediatric visit? When does that usually take place?
The newborn screening usually is done around 24 hours of life. Most people, they wait before they discharge the baby to do the newborn screen, and it's actually a sent-out test.
Okay.
The results won't be ready by the time of discharge, unfortunately, because it takes time. They have to send it through the mail to the central lab of the state, and it has to come back. And if it's normal, nobody hears about it.
Sure.
The parents won't be notified, but if there's something, some issues, usually the pediatrician gets a copy of the results, and the parents usually they get a copy, and the hospital, the birth hospital, gets a copy of this results.
Now, the results that in the event that something is abnormal or that requires follow-up, then that parent will be notified, and the pediatrician who is assigned to them before discharge, correct?
That's correct.
All right, so that pediatrician then who's assigned to them before they go home for the baby's follow-up and care will get those results. So it is very important then that contact information be correct.
Yeah, that is a very important issue, because there are oftentimes we find like wrong contact information, wrong phone number, or wrong address, and it creates a lot of stress on the hospital staff and the pediatrician to find out where are the parents and how we can take care of this issue right away.
Right.
So it's very important in the beginning, like when you come to the hospital, have your contact information updated, and if you know your pediatrician name and phone number, to give it to the hospital staff so they can send a copy of their newborn screen.
Right. So it's important for those moms who already have a pediatrician because they have other children who are, so in other words, they already have a pediatrician that they're seeing. Give that information upon registration or upon being admitted to the hospital and before discharge, so that this way, if there is something that requires follow-up, they can then follow up with your pediatrician. But in the event that you're a new mom for the first time, you don't have a pediatrician, that one is assigned to you before you're discharged, that the information is correct and updated, and if there's any changes before you're discharged, to make sure you let the hospital staff know so they can contact you in the event the newborn screening needs and or requires follow-up.
Yeah, some people, they have like a family practice provider, and they also take care of their newborn. So this information has to be on there too for their family practitioner too.
So, Dr. Rawda, can we talk a little bit too about, newborn babies? There's so much that's happening out there. You've got epidemics and flu happening and everything else. So, what are your recommendations when visitors are coming over? Because everyone wants to hold the baby, everyone wants to see the baby.
Oh, that's an important question, Lucy. Thank you. Visitors are important, when they come. I would advise, parents, if they have sick visitor, do not be in contact with your child. Visitor, like close visitor, I will say, or family member, they're allowed to touch the baby and help with the baby. Actually, as a matter of fact, that helps the mom as well too, as she's recovering herself. So she can take some break and they can handle her baby while she is taking this break. But we don't want to introduce like to the baby infections, especially if they have other sick kids in the house. They might transmit something. So hand washing is very important when they come to visit, and making sure that they got all their immunization up to date, like their flu shot or their tetanus shot. And we also always advise the parents, even in the hospital, we advise them to take their flu shot and take their tetanus shot to be updated.
Very, very important. Again, I want to remind our viewers that if you have any questions regarding newborns, babies in general, to please feel free to call Dr. Rawda at Illinois Masonic Hospital. He's located at the Professional Building, or just give him a call at 773-880-1075, 773-880-1075, should you have any questions for him. Dr. Rawda, I know we'll be more than happy to answer them for you. Our time here goes by really, really fast. We have time for one last question, but I think it's really important. Babies' newborn rashes. Sometimes babies have all kinds of different rashes. How come? What do they consist of?
That's a good question too, Lucy. Newborn rashes, the majority of them, if they come, we see them the first day of life, like if the baby will have like a birthmark, like a stroke bite, or like what we call Mongolian spot, like a bluish discoloration to the skin. Sometimes they have like a regular newborn rash. Some of the rashes can be serious, and usually when the pediatrician or the healthcare provider evaluate the child on the first newborn visit, they recognize those rashes early on. But some of them, they develop later on, like baby acne, it might be present. And this can be followed up as the child goes to the pediatrician office or healthcare provider office. Some condition, I can say they're serious and they need close attention. Some of them, they just need reassurance.
Well, our time here goes by so quickly, and we can continue to talk about babies and what babies go through and some of the things that are so important that need follow-up. And again, the importance of having a pediatrician. If you don't have one, please find one. If not, ask at the hospital that you're at, wherever you're having your baby. They'll always have some references for you, some referrals for you, and if you're not sure, just ask. It's so important to make sure you have a pediatrician or a family practitioner for family. Doctor, I want to thank you so much for being with us today. We really do appreciate you coming out and sharing this wonderful information for our new moms. So on behalf of all my colleagues at Hispanocare, Advocate Illinois Masonic Hospital, Gottlieb Memorial Hospital, our affiliate, Dr. Rawda, thank you so much for being with us today. And until next time, we'll see you on CAN Cable 21 with more interesting and information that's very vital and important to all of us. Thank you, viewers, for watching. We'll see you soon.